is Michelle Iandiorio. I'm the medical director of the HIV TeleECHO sessions here at the ECHO Institute. So the advantages to a spoke in participating in TeleECHO sessions are really numerous. So one is a feeling of a sense of community. These are like-minded providers from around the state or around the region who are also participating. You get to learn from their cases and therefore increase your knowledge and experience with the cases presented. In addition, for you particularly, it's really good that you have the access to this interprofessional team and the community of practice to bounce off ideas, present your patient case, and get real concrete answers that you can bring back to your case. And then also feel more comfortable with that particular disease state. Perhaps you become a regional expert, so people in your clinic look to you because you're the most knowledgeable about that particular disease state. The community partners presenting a case, we do ask that they think about how they would present the case ahead of time. So most of the TeleECHO sessions have a specific template for the case presentation that's requested. So definitely talk with the clinic coordinator and get that template. If you're working from a particular clinic that maybe has several members of the team, the healthcare team that are taking care of this patient, you may want to ask your colleagues to join you as you present the case. So if the community health worker goes out to the patient's home and you've got a pharmacist who's filling bubble packs for this particular patient and you think that their expertise will be relevant and helpful in presenting the case, then bring them along as well. Some people ask, how much is too much information when I present a case? So I think the perfect amount is that you say what the essentials are. Try to think about, if you were to boil the case down to a few sentences, what key information would be most important. Particular key information, sometimes it's medications, what kind of prior workup was done, sometimes labs are very relevant. You may or may not have to say that out loud, right? So sometimes it's just enough to include that information, and the people facilitating the case presentation can highlight those issues if you want. And you want the group to be able to ask clarifying questions. If they have no clarifying questions at the end, perhaps that was too much information. So these questions typically involve, is someone taking any over-the-counter medications? What therapies have they tried before? What prior diagnostic tests did they try? Do we think this patient is adherent or not? Do they have social supports? If we have particular recommendations, do you have those clinical supports in your area? Is there a therapist across the street? Do you have a local pharmacy? Is there a gym that's for free? One of the things that makes TeleECHO sessions so great and interactive for adult learners is that every participant can really be very involved. So whether I'm the person presenting the case, whether I'm a content expert or a community provider just signing on, I can also be really interactive. And so the best way to be interactive if someone else is presenting the case is really pay attention to the details and be thinking, if you were in the hot seat and the facilitator asked you for what are your clarifying questions or recommendations that you might have, be thinking ahead of time, how would I manage this patient? What additional information would I need to know? Many people are frightened by the prospect of unmuting and sharing their thoughts with this group of strangers. So I think one of the things that really helps is when you first want to share and really put your toes in the water and test out participation, is really think of a good clarifying question. That's totally safe. One of the principles of the TeleECHO model is really interprofessional care, right? And we want to work as a community of practice. And so every profession and every perspective from the healthcare team is important and valuable. That's really a key principle. So you don't have to be an MD or a PharmD to participate. We really want to hear your input.